Fisher, who wasn't vaccinated and lax about wearing a mask outside of work, has changed his mind about the COVID-19 vaccine. After nearly losing his life to COVID-19, Ben Fisher has changed his mind about getting vaccinated against the virus. Fisher, a 47-year-old deputy with the Lincoln County Sheriff's Office, caught the Delta variant of the coronavirus in late September, days after going to a LIBBY emergency room with low oxygen levels. He was fighting to stay alive on a ventilator at the Boise Medical Center in Idaho. During the darkest days of Ben Fisher's hospitalization, nurses had trouble proving him or turning him on his stomach to help distribute oxygen throughout his lungs. Born and raised in Troy, Ben Fisher said he had joined his neighbors in rallying around local families in need many times before. When you live in a small community like Troy and Libby, that is what you have to do, he said. While Ben Fisher was struggling in the intensive care unit, hospital managers allowed Christina Fisher to sit with him and give him massages. While medical staff assured her they were allowing her to be with her husband because they thought her presence might improve his condition, Christina Fisher later learned they were being lenient because they believed Ben Fisher was on death's doorstep. Against incredible odds, Ben Fisher's condition was improving by mid-October, and managers at the Boise Medical Center moved him out of the hospital's intensive care unit. As Ben Fisher worked to regain his basic motor skills, hospital staff made fewer exceptions to their restrictions on visitation, leaving him to spend long hours alone in the center's step-down unit. Eventually, Christina Fisher finagled her way into the unit, and managers later relaxed the hospital's policies. Christina Fisher said physicians with the Veterans Affairs Medical Center told her that patients like her husband, who were intubated at the hospital and infected by the Delta variant of the virus, had only a 5% chance of survival. Talking with doctors during rehabilitation also changed Ben Fisher's stance on vaccines. While Ben Fisher emphasized that getting vaccinated should be a personal choice, he recognized shots as safe and effective. Before transferring to St. Luke's, Ben Fisher received his first vaccine dose and noticed no side effects. Reflecting on how he reacted to the virus before his hospitalization, Ben Fisher said he might have done things differently if he had known the outcome. Christina Fisher said that her husband wore a mask at work, but they were lax in wearing masks to the grocery store, church, or their children's activities. Before he returns home, Ben Fisher will likely spend between 1 and 3 weeks regaining his strength. Due to the way COVID-19 affected his nervous system, Ben Fisher said the left side of his body was taking longer to heal. While he was excited to return to his patrol vehicle after completing his recovery, Ben Fisher said the thought of coming home to his family was what kept him going.